Prostate cancer affects men differently. Let's review what factors could impact which treatment is right for their individual disease. How about we start with symptoms?
So yeah, I mean, absolutely. I think symptoms are definitely something that plays into effect. Sometimes when patients are first diagnosed, they may not necessarily have symptoms, but bony pain, symptoms of urinary obstruction, there's specific treatments and strategies that we can deploy to help with those kinds of things. Um, Other factors that I think that we take into account when we're making decisions about which agent should any one patient receive is where are their sites of metastases? Is their disease just in the bones and the lymph nodes, or are other organs involved? What's the genomic makeup of the tumor? There are certain treatments that we would utilize if somebody had a certain specific genetic makeup for their tumor. I think other things that are really important are what kind of drugs has the patient seen before? Has that tumor been exposed to? Because that also helps us strategize for what to give them in the future.
Do you take into consideration the patient's comorbidities and their age, overall health, things like that?
Absolutely. Yeah, I think we need to absolutely take that into account. And I think age is one thing, but I think actually functional status is just as important as the actual number itself, because people are very, very different regarding the things that they can do at various age limits. And so that absolutely takes into account weighing in the side effects of any given therapy and how that may interact with somebody's existing comorbidities. And it may be something that we have to work with a team of other doctors to basically make sure that there is comprehensive, well-rounded care for any one patient. For example, some therapies may increase the risk of hypertension or increase the risk of volume overload. And so if somebody has issues with that already, we may have them see a cardiologist so we can make sure that, we're kind of addressing the totality of the patient experience.
What do you mean by volume overload?
Volume overload, I mean, if they've got like too much fluid on board, maybe they've have heart failure or something like that, and we have a therapy that's going to cause them to retain fluid, and so then we would have to work with a cardiologist to make sure that they don't run into issues.
Mhm. Once a man is undergoing treatment for advanced prostate cancer, how are they monitored to see if it's actually working?
So a lot of ways. So one is by just visiting with the patient and making sure that their symptoms are in check, they're not developing new aches or pains that are worrisome. It's by checking their labs. In addition to their organ and bone marrow function, we would check their PSA. And PSA isn't the whole story, but it is one factor that contributes to us determining whether a treatment may or may not be working. It's also doing intermittent scanning. So, CT scans of the organs and the lymph nodes and bone scan. And now we actually also have PSMA-based imaging, which can be integrated to help assess, where the disease is and not yet being utilized to assess whether something is working because we really haven't defined the criteria there, but it can be utilized as well.